My name is Roger Gaffey, and I'm a patient of Dr. Harper's and just finishing up an extensive period of working with him. We commenced an extensive disc institute improvement program on October the 3rd, 2011. And that consisted of a true axial spinal decompressions, new life laser treatment, oxygen therapy, spinal rejuvenation therapy, whole body vibration therapy, lumbar back brace, ice packing, and specific exercise programs with re-exams. That sounded like a lot. I didn't know what all those things meant when I entered the program, and I have a better understanding of that now. Completed the treatment today, which is February the 15th, 2012, and entered the program with disc bulges and degenerative discs causing really severe sciatic pain down my right leg. I had to give up golf, couldn't walk, barely, and was in really a lot of pain down the right, primarily down the right side. After all of the treatment, the pain is gone, has been gone for many weeks. I can now do Saturday morning 1.25 mile walks with my buddies again. I'm getting back to playing golf, taking baby steps. Dr. Harper recommended don't go to the first tee with the driver yet. And I have a continuing improvement program of exercise, which is really very valuable to me, of stretching and weight management. A side issue would be family life is improved because of my improvement with my health. I would say this program, I would recommend it to anybody with those types of issues that go on. And I just did a thumbnail sketch and really feel that about 86 to 90% improvement since day one when I entered the program. And I'm shooting for 100%, so I continue to work on it myself, and I think that's an important part of the program, giving you tools when you walk out of the office here to take care of yourself and your health. Thank you very much.
Hi, my name is Lori Escalera, and I live in North County, Oceanside, and I came to see Dr. Harper in June of 2011. I've had degenerative disc problems for 15 years, and I fell last year, and when I fell, I couldn't get my footing again. I couldn't work. I couldn't sleep at night. I had so much pain. I saw Dr. Harper's ad in the paper, and he offered a complimentary visit. I figured I had nothing to lose, maybe some sleep to gain. I came to see him, and within the first visit, I slept better at night. Within the second visit, I slept phenomenally well. So I decided to enter his program, and we did a combination of decompression and laser and exercises, and I'm happy to say at the end of my treatment I'm sleeping really good. I've learned to manage my pain very well, and I'm still doing the exercises that Dr. Harper introduced me to, and I'm very pleased with the program and the caring staff and the friends I made coming to Dr. Harper's Disc Institute. I think you should try it, and you've got nothing to lose and everything to gain. And best of luck. Thank you.
Hi, my name is Leroy. 6 months ago, had a bad sciatica. It was to the point where I had a hard time walking from my boat to the parking lot. There were times where I had to, a lot of times where I had to just lay down or sit down because I couldn't walk any further. And it was very uncomfortable, to say the least. It was nice that I got exposed to the Disc Institute, Dr. John Harper, and this was a month and a half later, I'm able to walk. I'm able to do things that I couldn't for the last 6 months. I'm recovering on a really good level now, and just makes me happy that I found the Disc Institute, because my life is starting to go back to where it was before I had this sciatica. The icing was really important, and the exercises are very, very important. And coming here on a regular basis with the laser treatment and the stretcher, I'm not so sure of the proper name of the machine, but it all worked, and I'm a much happier person because of it. So if you've got a bad sciatica, I'd say stop in and see Dr. Harper here at the Disc Institute and let him check you out. It's nice to be able to walk again. Take care.
Welcome. Today I'm going to share with you every single bit of information that I have gathered in 31 years of practice, over 7,500 patients, to take care of neck, back, disc, and sciatica pain. Imagine the freedom from the pain, the aching, the disability, all the problems that come along with suffering from those problems. And you can get better naturally, and you can avoid all the drugs, shots, and most of all, surgery. The patients that come to me do not want those things. They've tried those things, maybe even had a surgery or 2 or 3, and it just didn't help them. Hi, I'm Dr. John Harper from beautiful Oceanside, California, and I am honored to be with you here today. I cannot wait to share all this information with you. So sit back, relax, and pay attention, because this just might be the most important information you've ever received in your life. So today we're going to talk about chronic neck, back, disc, and sciatic pain. What is it? What causes it? And most importantly, what can be done to restore your spine back to health? I'm Dr. John Harper, DC. I've been in private practice here in Oceanside since 1986. I have personally consulted, examined, and treated over 7,500 patients. I am a board member of the American Functional Neurology Institute. I've been granted numerous awards and certifications over the years in my 31 years of practice. I regularly attend conferences and symposiums so I could stay on top of the cutting edge of research, diagnostics, and protocols. I am a 3rd generation Southern Californian. I'm very proud to say that 5 generations of Harpers have lived right here in Oceanside. Now I have my 4 kids and my 5 grandkids, and probably going to have more here. I got a son getting married, and probably another one that'll be doing that here pretty soon. So I really love helping people. I really enjoy what I do. I get up in the morning, and I'm very excited to get to the office and take care of people, because as I tell everybody, taking care of people and helping people, it's a blast. So matter of fact, here's one of my joys in life right here. My grandson Caleb, another beautiful child born to my family, and boy, what a great grandkid he's turning out to be. So my story, when I was 21 years old, I was scheduled for back surgery, and the surgeon said I had a 10% chance of being paralyzed from the waist down from the surgery for the rest of my life. I went home, called my best friend, asked his advice, and he said, well, maybe you should go see my chiropractor. And I didn't know what that was. I said, well, what's a chiropractor? What is that? What does he do? And he said, well, that's a doctor that uses your body's ability to heal itself. Thank goodness he didn't say this guy who cracks your back or neck, because I need somebody to uncrack my back. I had 2 herniated discs and horrific, terrible sciatica. So instead of going and doing the surgery, I went to the chiropractor, and 2 months later I was back to work, and 3 months later I was back to working out. And during that time of seeing that doctor, he recommended I go to chiropractic university. 6 years later I got out, started in practice, and here we are 31 years later, 7,500 patients later, and I still look forward every day to taking care of people and enjoying it. Now I am a chiropractor, but I practice structural procedures, functional medicine, and functional neurology, and we'll be explaining what that is through this video. So spine and disc damage is very common. It's a chronic disease that affects over 20 million Americans. It's the #2 cause of loss of work after colds and flus. Actually, billions of dollars, billions with a B, are spent each year on chronic back and neck damage. Many mistakenly believe that pills, shots, and even surgery are the only options for relief, and we're going to change that belief for you. Common indications of spinal damage: back and neck pain, legs, arms pain. You can get pain, burning, numbness, tingling. You can get foot and or hand issues. Again, pain, burning, numbness, tingling. Weakness, atrophy is the wasting away of muscles. You can get stiffness, fatigue, aggravation, loss of your ability to perform your regular daily tasks. Also, there's what we call unassociated neurological symptoms. These are loss of balance, peripheral neuropathy, which is damage to the nerves, vertigo, which is dizziness. You can get visual disturbances, depression, anxiety, brain fog, memory loss, headaches, low sex drive, loss of erections in males, irritable bowel syndrome, digestive problems, mood swings, and many more. And this is all due to the effects of spinal pain on the brain. Now, you may go have some spinal pain, and you might go to the doctor for these symptoms, and then you're getting loaded up on medications and shots for these things, when that's not even what the problem is. It's coming from your spine. So common treatments, and these are medical and structural treatments only, they don't include the metabolic and neurological treatment that's necessary to fully correct your health problem. So physical therapy, that's stretching, exercise, weight loss, heat, electrical stimulation. You can take medications to cover up the symptoms. Epidurals, these are anti-inflammatory steroid injections right into the spine, kind of a dangerous proposal. You got to get multiple epidurals, surgery, then you get more surgeries. Chiropractic is structural adjustments only. So these are the kind of typical things that people go for, and these things just don't work. So facts about surgery and epidurals: statistics shows that 1 in 100 back surgeries are successful in relieving pain. That's only 1%. Most surgeries take place again within 1 to 5 years. I know acquaintances that are orthopedic surgeons, and I've asked them, and their definition of a successful surgery is you don't have to do the surgery again in 3 years. Now, would you go buy a car if the car salesman said, this would be a successful sale for you if we didn't have to have you buy another car in 3 years? Now, the brain habituates to stimulus. So if the epidural works the first time, the brain and the body will get used to it, and it probably won't work after a period of time. Or maybe it's working right now, but in the future, it's not going to do its thing the way it's supposed to. This is the nasty back surgery. These are the scars that get left over. Here's the bones. This is the rods they put in, and these are screws shot into the bones. Sometimes they take strips of bones from your hips to do this. They're talking about doing microsurgery for the back injuries and so forth. Again, you got to cut through the skin, through the fascia, through the bone, and through the disc, and you got to get into the spinal cord sometimes. And again, still very dangerous. So why do doctors prescribe useless drugs that have such health consequences? Well, they're in a bad system. And to kind of let you know about this bad system, I'm going to have you watch this little short video here on a very important documentary on our, quote, healthcare crisis.
The American healthcare system is badly broken.
The present system doesn't work, and it's going to take us down. We need a whole new kind of medicine.
We're in the grip of a very big industry, and it doesn't want to stop making money.
If I spend 5 minutes with you and then put in one of these stents, I'll probably get paid $1,500. For me to spend 45 minutes with a patient to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
We don't have a healthcare system in this country. We have a disease management system.
We're spending almost twice as much in America as any other country on earth, but our lifespan isn't even in the top 20.
30,000 Medicare recipients die each year from care they didn't need. That's the equivalent of a jumbo jet crashing every single week. If the aviation industry killed as many people, we'd be up in arms.
The administration pays you based on how many patients you see. All right, who's next? If you try and buck the system, someone says, what can we do to get your productivity up? I'm not interested in getting my productivity up. I'm interested in helping patients.
We're seeing the military just being a microcosm of the problems society's having.
Soldiers' use of prescription drugs has tripled in the past 5 years.
This medications I was on.
Only by accepting that the American healthcare system is badly broken will we be able to seek out the escape fires, the potential solutions. There are answers.
One company has figured out how to lower healthcare costs by more than 40%.
We provide incentives for people to engage in healthier behaviors.
The Army Surgeon General directed that we establish the Pain Management Task Force to take a look at alternatives to narcotics.
I was skeptical, so skeptical.
I've gotten a lot of inspiration, a different perspective. There's a different way of doing things that is possible.
If I think about what healthcare could be like, it would have a lot more care in it.
The healthcare system is unsustainable. We're really mortgaging the future. Not just the health of healthcare, we're talking about the health of the nation.
It's a shame that we have to have this kind of thing, isn't it? But I'm going to let you know there's an alternative, and you can have hope because of what we do here in our office. So all chronic illnesses, and this is what makes me different, is that all chronic illnesses, in my opinion, are a combination of neurological and metabolic problems, and they require proper neurological treatment and metabolic treatment. So to explain what I mean, we're going to move over to what I call the magic board, and I'm going to write this all out for you. So here we are at the magic board. And why is this magic? Because this is the magic of how I get patients better. This is how I explain why I do works. And this makes sense to me, and it makes sense to every single one of my patients. So let's do this. So there's a metabolic side. There's a chemical part to your body. This is you eating your food and turning it to energy. Here's the neurological side. This is your brain, your nervous system, your peripheral nerves, your spinal cord. This is what directs everything to happen. Your brain tells your body how to take that food and turn it into energy. But your brain and your nervous system uses a full third of that energy. So what ends up happening is that these two things are intertwined. What the brain does to tell the body to make the energy has to make the energy for the brain and the nervous system and the peripheral nerves. Does that make sense? Makes sense to me. So this is what happens. Let's say there's an injury. Doesn't matter where it is. Doesn't matter if it's your back, your knee, something happens to you, something causes a problem, and it doesn't allow the body to work the way it was meant to. So let's say it causes you to not exercise as much as you should. So not exercising causes a problem with your brain. Your body needs some sort of exercise. So if you're not exercising, this causes problems with your neurological system. If your neurological system, if your brain and your nervous system isn't working right, it can't tell the metabolic, it can't tell your body how to do the metabolism right. And so that's going to go down. Now, if the metabolic side goes down and doesn't produce the energy that the brain and nervous system needs, that's going to cause this to go down. All right? So let's say this is a symptom, and we'll call this brain fog. Okay? So you go to your doctor and you say, oh, I got some brain fog. All right, I'm not really doing that. So you'll get some medication to cover up the brain fog. And let's say you come on over here and your body, your neurological system is not telling the body how to create food properly. And let's say it's in your stomach and you start getting some heartburn, or you get some acid reflux. And so then you're given some antacid to cover up that symptom. Well, but the medication that you take over here further doesn't let you digest your food properly. You know, if you take an antacid or something for acid reflux, it wipes out the acid in your stomach. Well, you need that acid to break down your food, don't you? And so now your food's not getting done, and so this creates another problem. So now you start becoming depressed, and you say, oh, doctor, I'm depressed. Well, then you get another medication that you take for that. Well, that medication causes its own symptoms, and that further depresses the neurological system. So can you see that you go, oh, well, gee, you know, now I got this knee pain, or I got this back pain. So what's happening is you keep taking medications that keep causing problems on both sides. And it was kind of interesting when I was explaining this to a patient a couple of years ago, as he was looking at these down arrows, he says, oh my gosh, doc, it's the race to hell. I said, well, that's good. I'm going to write that down. And so it is. Because when you keep covering up your symptoms, right, you're just covering up your symptoms. You're just hiding the chronic problem, and it just keeps getting worse. So what I do that's different is we look at you metabolically, neurologically, and we address whatever this injury was structurally, and we address all three at the same time. So what happens now? So as we address you metabolically, that makes that a little better. Well, that's going to make the neurology a little bit better. And then that's going to make the metabolic side better. This is going to make this side better, and like that. And so what ends up happening, instead of having this problem with injury, what you're going to end up with is real, true health. Not just a bunch of covered up symptoms, not just a bunch of side effects from these drugs, and you won't be ending up with a chronic health problem that will at some point require really drastic things like shots and surgeries. So this is why we address the metabolic and the neurological sides at the same time with the structural, because we want to get you back to true health. Amazing, huh? It makes sense, doesn't it? Makes sense to me. So see what I mean by you got to take care of the neurological and metabolic things at the same time? If you don't, you'll never get better, and by doing those things, you will always get better. So what do I mean by metabolism? Well, you eat food and it turns into energy. So I wanted to ask you a question. 30% of energy goes to what system? There's the endocrine system, there's the digestive system, nervous, immune, cardiovascular system. Well, the answer is the nervous system. So our brain, our spinal cord, our nerves, we all need good metabolism energy for a good functioning brain and nervous system. We need a good brain for a well-functioning spine as well. So to put it another way, bad metabolism, bad injury, causes fatigue to the brain and cerebellum. Cerebellum is for accuracy, balance, and coordination. Also tells the muscles of your spine how tight to be on both sides. This can cause structural damage to the spine. Muscle tightness, discompression, injury, joint misalignment, pinched nerves, degenerative arthritis, stenosis. For permanent results, all three must be properly treated. The structural part, which we use decompression and laser, I'm going to explain that to you in a minute. Neurological, the brain and cerebellum, and metabolic. Got to take care of, get rid of that inflammation. So, have you had all three done at the same time? If not, no wonder you're not well. So, the leading causes of back and neck, disc, and sciatic pain are uncorrected and damaged back or neck. It leads to spinal degeneration. Brain cerebellum issues, and metabolic issues. So these are the chronic spine conditions. So here's a normal disc, nice square, rectangular space between a square bone. Degenerative disc where it's rotting on the inside. A bulging disc where it's bulging into the nerve space. Herniated disc where it's completely collapsed and squeezing into the nerve space. Thinning disc space. And severe disc degeneration with osteophyte formation. These are all forms of arthritis in your spine. So when somebody says, oh, I just have a little bit of arthritis in my spine, oh my goodness, that's terrible. And sometimes physicians will kind of downplay it because they really have nothing to offer for you to fix this, again, other than those epidurals and the surgery. So a common trait of a damaged spine is that your spine is compressed, placing pressure on the nerves that go to your legs and feet from your back, just like here, or if it's in your neck, it goes into your arms and your hands. So we use a thing called non-surgical spinal decompression. Spinal decompression is one of the many weapons in our spine disc sciatica recovery program. So very simply what you do is you're lying on a table, a brace around your waist if the problem is in your back. You lie on this little carriage that lifts up your head if the problem's in your neck. And this cable goes to a computer. And we put specific things about you in the computer, and then it very gently pulls on you, opening and separating this space here. Now, I want to show you here kind of up close what we're talking about. So here's your spine. Let's say this is where the damage is. So everything is bending nicely except for right there. So when we do decompression, it's specific for that area and problem. Things like yoga and stretching and physical therapy and traction, hanging upside down in swings or boots, pulls on every single part but where the problem is. So that makes the problem worse. It might make the muscles feel better for a while, but this is what you need to do to fix those areas that are specifically damaged. So I want to show you a little video here of what decompression is and how it works on your spine. See, here's a person lying on the table, and as the animation shows, this area starts to come slide apart. And then what happens, you can see that the spine is actually being pulled apart, and that is creating oxygen and nutrition, the fluid, to go into that space. Let's take a look at that one more time. So as the cable starts to pull on the computer, it gently pulls on your spine, creates a negative pressure, sets oxygen and nutrition into that spine, and this causes the healing. Now I wish I could tell you that's what it's going to do in one visit. Unfortunately, it takes periods of time because the damage that's in your spine, that took a long time to get there as well. So what else do we do to repair the spine and disc? Well, the class 3 low-level laser. Now people hear laser and they think, oh, this is something that's going to burn me. They think of surgery or cutting metal. Well, this is low level. It's cold. It doesn't cause any heat sensation at all. And what it does is it shoots photons inside your body and it recreates the environment for the disc and the nerves to heal. So it's a specific wavelength of light, and it's been scientifically proven to go into the nerve cells and stimulate energy production inside the neuron, allowing it to heal. It also stimulates microcirculation, so it starts growing those blood vessels around the nerves and the disc, and it also does lymphatic drainage, gets rid of the inflammation. So the effects are decreased pain, decreased inflammation, and increased tissue growth. Let me show you a little video here about laser action. So here's the laser shooting the photons, and here you can see the damage right here. And so what's happening is you can see the damage is going away. As the damage is going away, we can see, wait, here's the microscopic. The black is the damaged tissue coming off the cartilage and nerve cells. And then right here we can see the good white stuff going in there, and that causes the healing. So here is an example of a patient that came to us. This is Jim, and Jim has disc problems, pinched nerves, stenosis, sciatica, peripheral neuropathy, lots of different problems. He had a hard time walking, barely from the front door to the mailbox. After 4.5 months, we retook the x-rays. Every one of these blue arrows is pointing to a space where there's supposed to be a disc. If you look at here, you can see just how dramatic the improvement has been in a short amount of time. Now Jim's gone from barely walking to playing 2 rounds of golf, walking the course every week, 18 holes. That's a dramatic improvement, and very pleased to have Jim as one of our very special, very well-doing patients. So let's move on to the brain. So if there's a brain malfunction, we got to use brain balance therapy. So what is brain-based therapy? Well, if your cerebellum is fatigued, either from the spinal problems, the spinal pain, maybe some metabolic issues, you get loss of balance, vertigo, chronic neck and back pain, clumsiness, dropping things. The cerebellum controls your eye reflexes, your accuracy, and your spinal muscles, like I said. So if you have a bad cerebellum, you're going to have a bad spine. So the cerebellum and brain require two things to function properly: good glucose, good oxygen, and fuel, and it needs activation, brain exercise and activation. So what do we use for activation? Well, the HACOMed horizontal microcurrent therapy. We're one of the first offices in all San Diego County to use this therapy for back, neck, disc pain, and sciatica. And so what does it do? It stimulates the nerves electrically, it blocks pain, it improves blood flow, it stimulates the nerves biochemically, it allows for greater metabolism and healing, and it reduces inflammation locally. This is a $25,000 piece of equipment from Germany, and it specifically helps the nerves to work. Your nerves and your disc both have an electrical component and a chemical component. And when you're using this machine, both of those things are handled at the same time. This is how we get such dramatically great results that people don't, they call us from around the country and from Mexico, and they come and see us to get great results like you can. So there's 100 different forms of electrical therapy, and like I said, this is the only one that has the electrical and chemical in it. And when the nerves start to die and have damage, this has got to be stimulated and worked. Also, we use what's called peripheral neuropathy rehab therapy. This is a therapy machine that we give you and you take home and you get to keep it. I want to make sure that not only are you getting better while you're in my office, I want to make sure you stay well after we're done with our care. So this stimulates the peripheral nerves, and so you put, we actually use a foot spa setup now, or we use pads for the hands, and again, this is yours to keep at the end of the treatment program to stimulate the nerves. So what else do we do with the spinal decompression? Class 3 or 4 low-level lasers, the HACOMed horizontal microcurrent therapy, the take-home PNR unit. We use vibration with oxygen therapy. What does that do? Well, if you're using oxygen, that increases the oxygen in the body, and then as you're doing the whole body vibration, it's a medical grade. It'll stimulate the muscles around your stomach and your back and your rear end and legs to help hold the spine in place, as your neck as well. And it'll also stimulate your brain. Like I said, the brain likes stimulation. Very important, I keep talking about inflammation. Inflammation means to ignite or to bring into flame. You can't build a house that's on fire. If you saw this house burning and you saw a guy over here putting new windows on the house, you think that guy was crazy. Well, I think the same thing when I see patients trying to help their health but not doing anything about the inflammation. That's just loco. You got to take care of the inflammation as well. Inflammation is like little machetes running around inside your body, cutting up things. And until you get rid of the inflammation, you're going to continue to have problems. So you have lots of chemical stresses to the brain, spine and cerebellum. There could be anemias, problems with your blood, your red blood cells, blood sugar imbalances, food sensitivities, immune system problems, poor diet, hypothyroid, drugs, prescription over the counter, hidden infections. These are the things that cause these metabolic problems create inflammation. It causes the spine, cerebellum, and brain to have problems. So metabolic causes need to be addressed if you're going to win the battle against back, neck, disc pain, and sciatic pain. Specialized blood work. Okay, now I use about 60 tests where most physicians use about 15, 4 times the amount of tests. Also, I look at tests much differently than your physician does. See, most people say, "Oh, doc, I don't need to do any more blood tests. All my tests are normal." Well, let me explain why that's a fallacy. See, lab ranges are inaccurate because they use what are called bell curves. So every year, all those lab test results are sent off to an organization and they average them. They take everything and they average it. So if you're average in between here, that's normal. If you're out here, it's too high or too low. But let me ask you, who is going and getting blood work? Healthy people or sick people? Sick people. So these averages are sick people. So when I look at somebody's blood work, I say to the patient, do you want me to take care of you and do this where you're just not dead? Or do you want to be healthy? And they say, I want to be healthy. This is why I use functional lab values, because they're more sensitive to reveal problems. So let me show you. Here's the bell curve. Here's the straight part. Here's the bell, and here's the other part. So over here is abnormal low, abnormal high. So typically a physician will say that these are normal labs. This area right in here is where the normal lab ranges are, but not the functional lab ranges. So you're sick, but not sick enough to trigger something to be done because you're considered in the normal ranges. So let me give you a further example. So let's get your glucose tested, and let's say you come out with a 73. Traditional high-low ranges is 65 to 110. Your physician's going to say, you're fine, you're normal. But when you use functional ranges of 85 to 100, I'm going to look at this and go, oh my gosh, you're hypoglycemic. Why are you low in energy? No wonder you're having health problems, because there's not enough energy to go around to correct that problem. And we do the same thing with these other tests. So when you use brain-based therapy, advanced treatments of structural problems, and lab-based metabolic care, this is what we call neurostructural integration. We are attacking the problem from all sides, and we are giving you a holistic approach to getting well and healthy. So what makes our office different from every other doctor that you've ever seen or ever heard of, for that matter? We treat patients structurally, neurologically, and metabolically at the same time. And I'm here to tell you that I'll leave no stone unturned to determine the exact cause of your condition and what do we need to do. This is what I do. I'm a great detective, and then I'm a great doctor, and then I'm a great teacher. I'm a detective to figure out what's wrong with you. I'm a doctor to work with you so you get better, and then I'm going to teach you how to take care of yourself. So key points. It takes many things to correct back, neck, disc, sciatica pain. Not just one thing will do it. You must address the underlying structural, metabolic, and neurological problems to have great success. This condition is progressive and degenerative. What do I mean by it? It will only get worse over time. That means that the symptoms you are experiencing now are just the tip of the iceberg. I can't understand when somebody says, oh, it's not too bad, I'll wait till it gets worse. Right? That's crazy. That's like looking at the oil light coming on in your car and say, well, I'll just do something about it when I burn up the motor. This is, again, crazy thinking. This is not the way to do it. Our recovery program is the most comprehensive and state-of-the-art in all of Southern California. Again, this is why people get a hold of us from all around. So, in summary, you got to have the comprehensive blood work using functional ranges to clearly identify any underlying metabolic conditions. You got to remove the causes and add supplementation. You got to do structural correction and brain cerebellum activation, spinal decompression therapy, class 3 or 4 low-level laser therapy, the HACOMED horizontal microcurrent therapy, the take-home PNRT unit, vibration therapy with unit, oxygen. See, this is really important. You got to do everything at the same time. You can't pick or choose. So what's next? Make your appointment. Now, if you're watching this and you've already been in my office and you're getting ready for your report of findings and your 2 therapy sessions, you're not making any new appointments. We're going to review a little bit of what you've already done. But if you're watching this as somebody that's watching it online or somebody that's getting some more information, then here we go. This is what is next for you. So I recommend you come in for a visit. On my first visit, I'm going to have a conversation. I'm going to sit down and talk to you for 10, 15 minutes. We're going to listen to your story. I'm not going to ask you a bunch of yes/no questions. You're going to tell me about your health because it's all important. I want to listen to you. I also want to know your health goals. I want to know the things that you want to go back to do. By knowing that, I will be on the same page as you. I want to know your goals because those are going to be my goals. I want to do a complete orthopedic neurological evaluation on your spine and your nervous system to make sure it hasn't gone too far. The damage is not out of my hands and into the hands of a surgeon. I also want to make sure that your problem is something that I'm an expert at. We're going to review any images. If you bring me anything, x-rays, CT scans, MRIs, anything, I will take a look at those things. If you don't have them and we need them, I'll let you know how to get them. Bring any existing labs, very important. I'll take a look at those. And come with your spouse or significant other if applicable. If you have a situation like I do, if you're married with a person that you make decisions together about your health, about time, about finances, this is somebody who needs to know what's going on with you so they can be part of your help and part of your program. So if I can accept you as a patient in my office, and about only 2/3 of the people that show up at my door actually start the program because either it's gone too far or I just don't really have the confidence the patient's going to do what they need to do. And if they don't get better, it makes me look bad. It wrecks my reputation, and I don't want to have that. So if we can accept you, we're going to do an overview of any further testing that needs to be done, review the findings from the first visit, the exam, and we'll do that. If we have the x-rays or the images then, we'll go over them then. Overview of the treatment plan, review of the investment of the finances that you'll have. Those things will all be in writing. And again, with the spouse, if that's, or significant other, if that's the thing. Now, because of office limitations, I only accept 10 new recovery program patients a month. Normally the cost is $250. If you make the appointment after watching this, I'm offering you this $250 value for $49. You reserve the appointment now, I'll include 2 days of treatment. That'll be the exclusive HACOMed horizontal therapy, class 3 laser, decompression, PNRT, anything that applies to your care. I want to make sure that we're going to be able to help you. I don't want to waste your time or money or my time. So we're going to do 2 days of therapy, and I expect to see some improvement. Now, if you've had something that's been there for a long time, years or decades, the change may be small. It may be something that we see on the exam, but there will be something improved. Otherwise, I don't know if this is something that I want to work with. What else do you need to do for your appointment? Well, I want you to have some kind of shorts, sweats, something, pants. I need to get you from the kneecaps down to your feet, the elbows to your hands. Again, bring any previous imaging. If you're coming back for your next appointment, bring all the, send in the paperwork and get those images to us first. And then again, bring the spouse or significant other. So let's talk about some rules to acceptance to what I do. Again, I don't accept everybody. You're going to have to be willing to make some lifestyle changes. I'm pretty sure there's something that you're doing that's causing a problem, and it's contributing to your poor health. So we got to take care of that and get rid of that thing. What is that? I don't know until I see your blood results. You got to be taking accountability for your health. This isn't Sears like your car. You drive it in, they take the battery out, put a new battery in, and you go back out and do the horrible things that you did to ruin the first battery. You're going to have to make some changes. You're going to have to take some responsibility. Now let's talk about finances. So insurance and Medicare is going to pay very, very little to none. And this is what I mean. Very, very little to none. Let me do that again. Very, very little to none. These things are not covered by most insurances because it's not shots, drugs, or surgery. You say, well, it covers chiropractic. I'm not adjusting your spine for the most part. If you need that kind of thing, I'm really good at it, but we're doing functional medicine, functional neurology, and structural procedures. This is way different. But we have made our care program so affordable that 96% of the patients that I do accept into the program, they can afford it. We've made it that you can make payments of $200 to $400 a month for 18 months on the care program. Now the care program's not 18 months, but you can make these payments and it's interest-free. And again, I don't know where you'll be on that scale of $200 to $400 a month. It just depends on what we find and what we find for that. Now, there's 6 things that I want you to think about before we go any further. On a scale of 1 to 10, how serious is this illness to you? How important is it to you to get better? Where do you see yourself in 3 years if you don't fix this problem? Again, it's progressive and degenerative. It's just going to get worse. How's this affected your relationships, your work, your ability to enjoy life? Think of 3 things that you could do if you didn't have this problem. Wouldn't that be great if you could fix that? And go back to doing those fun things, because that's what really life's all about. Like I said, I was with the grandkids earlier today. God, that would be miserable if I couldn't run around and play with those kids and throw them up in the air and pick them up and have a good time. Yeah, that's a real joy in my life. On a scale of 1 to 10, how serious are you about eliminating your chronic condition? If you're an 8, 9, or 10 and you're that serious, great. We're going to do great things together. If you're a 1 to a 7, I'm not so sure we should be working together because I have doubts that you're going to do the things you need to do. Due to time constraints, I'm only going to accept those people who truly are committed. And if you're not truly committed, and you're getting healthy, please, let's not go any further in this process. Let's not waste anybody's more time. At this point, I'd like to share with you just a little short video. It kind of points out the differences of how you are, how you're going to take care of your health or not take care of your health, and the consequences. And I'll be right back.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? vitality, or get old with disease. It's time to decide.
See, every time I watch that video, it reminds me of my mom and my dad. Both of them depended on medical doctors and thought that medical doctors knew everything. And both my parents, if not died, were certainly helped along the way from medical malpractice, because both doctors didn't do the right thing. They did what was important for them and not what was important for my poor parents. And unfortunately, my parents aren't here to see, my great joy and my happiness in my life, my success with my patients, my practice with my family, with my wife. They're not here to see that anymore, and it makes me really sad. And I don't want that to ever happen to you or anybody or your family have to go through what I'm going through, missing both my folks. With all that, I just want to thank you very much. Thanks for your time and your attention, and we'll see you soon. So we're here with Ashley and her mom, Steph, and they wanted to tell everybody a little bit about what we did here at our office. So Ashley, tell us a little bit about the problems that you had before you came into the office.
I came in basically not being able to walk or anything. I was in a really bad car accident and proceeded to work at my labor-intensive job of being a pet groomer for a year. Saw multiple doctors over the year span. Nobody could tell me it was wrong. And walked in here. Dr. Harper took a look at my MRI and my X-ray, and it was like, I know exactly what's wrong with you. And it was like an answer from God. It was absolutely amazing after all I'd been through. And I had 4 herniated bulging discs that had pressed on the nerves in my spine and caused numbness and tingling and loss of feeling in my legs and my hands, which of course grooming, not so good. So I had to take a break and everything, and now I'm feeling much stronger, and it's remarkable. For a while there, got very down, didn't think it was going to get better, and the encouragement of you and the staff here and everything, it was more like coming to family, and that you guys were really here to help. So it wasn't like a doctor. So
great, thank you. That's great.
And I have my daughter back now.
That's awesome. Yeah. So it was real rough on you too, Steph. Huh?
It was unbelievable. It happened in November, and for a year thereafter, 24 years of age, she was working, doing her business. She'd come home, she'd ice up for the 20 minutes, and she'd go straight to bed. For a year, there was no social life. There was nothing that whole year because the pain and the swelling was so intense. And then she had a neck injury, and it was too much for anybody. And like she said, we'd go to these doctors, and it was like, well, yeah, you've got a herniated disc, and you've got probably 4 of them, but all that we can tell you is bed rest. And they didn't quite get, she's self-employed, so how do you equate the two? And so she did reduce her work schedule to try and accommodate, and working only 4 days a week, 2 days off 1, 2 days off 2, that whole year. And still, it got worse and worse.
Of course, everybody knows we have bills and rent to pay and
yeah,
animals to take care of. So
right.
I just couldn't stop. And the most frustrating thing was one doctor told me that I had the herniated disc, and that if I kept going and working and doing what I was doing, I may need to have major back surgery. Right. And that was like the worst thing, because I know people, my aunt's friends who have had it and have to get it replaced like every 8 years because your spine rejects it. And it was like, I've watched my mom my entire life be in pain because she's been handicapped since I was little from car accidents, and I didn't want to spend my life suffering like that.
Good. So, and you touched on it just a little bit, but I always ask people about this. So, and how were we with when you came in? How did you feel about the respect and the honesty and the professionalism?
I mean, I've been to a lot of doctors in the last year, and a lot of chiropractors, a lot of acupuncturists, a lot of everything to do with the body. And coming in here with Adriana up front, she always has the biggest smile on her face, and she's got the sweetest, kindest eyes you've ever seen of anybody. And then coming back here, even when I would have days where I would be in so much pain, I get so sad and depressed, and I would come in here, or I'd miss an appointment or something, and be too embarrassed to call and cancel. And I'd come in here, and it wasn't like you were scolding me, it was like you were supporting me and pushing me. And it was just really nice, because it was kind of like a dad or an uncle or something who really genuinely cared about you, and it wasn't like it was a doctor and I'm the patient and you've got 700 other ones today. So it was very awesome.
That's great.
Extremely professional. And like you said, we looked elsewhere, and one place was like a factory. It was like an assembly line.
Like they messed up my name twice. And they had a file in front of them, so
Very great.
I was like, okay, I can believe it.
Oh, great. Well, I appreciate you guys doing this, and believe me, Ashley and stuff, it couldn't happen to two nicer people. So I am so blessed to have you guys here, and I'm glad that you got your life back, because that's fantastic.
Thank you.
Yeah.
You're very welcome.
Unbelievable.
Good.